Hello, welcome to Anatomy with John and Scully. Today we'll be talking about the tibialis posterior muscle, going over origin, insertion, action, innervation, and blood supply. Thank you for joining. Alrighty, tibialis posterior, starting with the origin. Alright, so the tibialis posterior is going to originate on the lateral aspect of the tibia, just below the soleal line. The interosseous membrane and the proximal half of the posterior fibula. It's going to insert on the tuberosity of the navicular, the cuboid, all three cuneiforms, and the second, third, and fourth base of the metatarsals. It's going to receive blood supply from the fibular artery. So if we follow the femoral artery here, it's going to dive deep at the adductor hiatus to form the popliteal artery. Popliteal artery is going to come down. At about the head of the soleus, we'll get a dive anterior and lateral of the anterior tibial artery. What's going to continue down is the posterior tibial artery, which is going to travel medially, and around here we're going to get the exit of the fibular artery, which supplies blood supply to the tibialis posterior. Moving on to innervation, it's going to receive innervation from the tibial nerve. Tibial nerve comes off the sciatic, and this is coming from L4 to S3 nerve root levels. So let's follow the sciatic. Sciatic's coming down and around the apex of the popliteal fossa. We're going to get the bifurcation of the fibular nerve as well as the tibial nerve. We'll follow the tibial nerve down, and that's going to supply innervation to our tibialis posterior. So once again, innervation, not blood supply. Moving on to action. It's going to help us to plantarflex as well as invert the foot and ankle. So there you have it. Origin, insertion, action, innervation, and blood supply of the tibialis posterior muscle. As always, do not forget to eat your leafy greens, and thank you for joining. Take care, folks.